So, what are the 8 senses? You've probably heard of the first 5 already, and you can see from the picture we've got vision, hearing, touch, smell, and taste. But you might not have heard of the other 3, and I'm going to go into those in a little bit more detail so you understand them and so you can understand your children a bit better. The little man stretching at the top is representing something called proprioception. This is about knowing where your body is in space. The upside down man with his head in a hole is representing your vestibular system. This is about balance and knowing where you are in relation to upright. And the third picture, the little boy with all his organs displayed, is supposed to represent an 8th sense called interoception. This is about understanding your feelings from inside, such as pain, hunger, fatigue. Let's talk about proprioception in a bit more detail. Proprioception is knowing where your body is in space without having to look at it. It means you can walk down the street without watching every footstep, knowing where you are without falling over, having a good image of your body in your mind. We'll do a little experiment to help you understand this. So wherever you are at the moment, if you're sitting in a chair, close your eyes. And then if you've got your legs crossed, raise one of your arms. You can open your eyes now and you can look and check to see if your legs are crossed. You will have been right, obviously, because you knew where your body was without having to look at it. You might have felt the pressure of one leg on the other. You might have felt one foot on the floor and one foot dangling. You might have been able to perceive that one hip was at a bit more of an angle than the other hip. All of this gives us an image in our brain about where our body is in space, so that when someone says, "What position are you in?" you don't have to open your eyes and look. I like to think of this like minions in our joints and in the muscles and the tendons and ligaments around our joints, all sending messages up to the brain all the time, telling the brain what position that joint is in, whether it's squashed, whether it's being distracted, whether it's bent or straight, whether things are on stretch or not. All that information goes up to the brain and creates an image in your brain that you constantly refer to, without knowing it, to know where you are in space. This makes us feel comfortable and calm, and it happens all the time. Proprioception works best when your body is put together really well. So you have good muscle tone. That's about how tense your muscles are at rest. If your joints are put together well, so they're nice and sturdy and nice and stable, that gives us better proprioceptive feedback. And if the messages from those joints and from those muscles are able to travel up to the brain and then get registered in the brain appropriately, you'll have good proprioceptive feedback. Lots of children we work with don't have such good proprioceptive feedback. Sometimes their joints are a bit bendier than most other children. Sometimes their muscles are a bit floppier. And sometimes, for some children, the messages just don't travel to the brain as well or don't register in the brain as easily. These children don't have such good proprioceptive feedback. They don't know where their body is in space without looking at it. And so it means they have to do things to get more proprioceptive feedback to make them feel more comfortable. If you think about yourself, sitting in a chair, watching the TV, listening to some music, you probably need to change your position every 15 to 20 minutes to be comfortable again. The children that we work with who have poor proprioceptive feedback seem to need to do this a lot more often. That's because every time you move, the minions that we imagine are in our joints send a flood of information up to the brain to tell the brain that the body's moving and it's now in a new position. That makes us feel calm again and makes us feel better in our body. So children with poor proprioceptive feedback need to move a lot more than most of us do. They tend to be quite fidgety. They tend to get into positions that give them more feedback, which are often squashed up positions where there's a lot of pressure going through their joints and their muscles. They might want to squish up to you on the sofa, or hang off you, or hang off items of furniture or things around the house. You might find they have to sit on their knees at the table or curl up into a ball on the sofa to get the proprioceptive feedback they need to feel more comfortable. It can be quite annoying when they always want to be on you, when they're fidgety, when they can't sit through a meal, but the chances are that movement and that squashing of their body is giving them better feedback so that they know where they are in space. Let's move on to vestibular processing. Your vestibular system helps you balance and helps you know where you are in relation to upright. It's made up of semicircular canals which sit within your inner ear. These are fluid-filled channels and they're orientated in an upright position, a horizontal position and a position at sort of 45 degrees. The fluid in those channels moves in relation to your head to tell you where your head is in relation to upright. The easiest way to understand this is to think about a bottle of water. The water inside the bottle will always find its level because of gravity, whether the bottle is upright or resting on its side. When you spin a bottle of water, the fluid inside the bottle spins too. When you stop spinning the bottle, the fluid continues to spin for a short period of time until it settles again. If you imagine this is your head and you spin around, as you might have done when you were a child because it's quite fun, the fluid in the tubes in your inner ear will also spin. The point when you stop spinning your body, but you feel dizzy, is because the fluid inside your inner ear is still spinning, just like it did when we spun the bottle of water. Some of us have really good vestibular processing. These people tend to enjoy things like roller coasters, being upside down. They might be adrenaline junkies. They might be the sort of people that can read in the car without getting sick for long periods of time. But some of us are the other end of that scale and don't have such good vestibular processing. We're generally the people who get car sick really easily, have to watch the road when we're moving in a car, might not be able to map read for more than a few seconds without starting to feel a bit sick. You might even be the sort of person who can watch something moving and start to feel a little bit sick with it. This is normal. What isn't normal is to be outside of that range in terms of vestibular processing. So some of the children we see find vestibular processing so difficult that they can't even be in a room of people moving around them because the movement of their eyes, when they're tracking so many different people moving in the space around them, starts to make them feel a little bit sick or a little bit unusual. Equally, there are children at the other end of the scale who just can't get enough vestibular processing. They crave movement, they want to be upside down, they're on the go, they like their head to go into lots of different positions to swish that fluid around as much as possible to give them the kind of hit you normally get when you make yourself dizzy. Hopefully you now have a really good sense of what we mean by proprioception or proprioceptive feedback and vestibular processing. It's important to understand both of these senses really well if you want to understand the things that your child does and then go on to understand how you can help them.